It's my pleasure to welcome you today. This is the first in a series of monthly webinars that we're going to be hosting. They're all going to be around COVID-19 and what we're seeing, the effects across our global programs, how it's taking hold of children's lives and how we're responding to that. This one in particular, we're focusing on health. Mostly because it is an urgent concern and also it's a very interesting topic and a lot to it. So I'll introduce myself very quickly. I am Amanda Morgan. I'll be your host today. I am the Director of Private Humanitarian Response Fundraising. So this is a particular interest and focus of my work. And I'm also joined by two of our leading Save the Children's experts, and I'll introduce you to those in just a minute. First, I just wanted to say a huge thank you to all of our supporters. I think it's very important that we have these conversations. We invite you to them so you can hear how your money is doing the work that we're doing every day. So we've got individuals on this call, we've got corporate supporters, we've got foundation partners. They all make up a big group of supporters of our work, and we wouldn't be here today if it wasn't for you. So thanks for joining us. I also wanted to take a moment to just go over a few housekeeping rules. I know with everything happening, you are all probably very adept at using Zoom, but just really quickly, everyone's lines are muted and we are recording the call. If you are in the meeting on your computer, you should be able to see us on your screen. If not, you're just hearing us, and that's fine. You can also ask questions at any time during this conversation, and I really encourage you to ask questions. We're going to do our best to make sure that we don't speak industry speak. We're going to make sure that we not use acronyms. If we do, just let us know if you don't know what that means, and we will make sure that we get to it in the chat box. If you are on the phone and you want to ask a question, that's great too. So you can email that question to events@savechildren.org. So please feel free to do that. While we're talking, again, just put your questions in the chat box. We're going to try to get to as many of those questions as possible, but in the end, we're going to have a Q&A session, and that's when we might get to your question. So hopefully we're not going to miss any of them. Now, I'm going to give a very brief background on why we're here so then we can give enough time to the speakers today, because we only have a short time with them, and we want to cover a lot of ground here. So as you know, the COVID crisis is really unlike anything we've seen in Save the Children's lifetime, and we've been around for 100+ years. So this has been a huge, massive effort globally for all of our staff. I think there hasn't been anybody within our movement who hasn't been working on this. It's changing the world in unprecedented ways, and we expect to see changes in our programs for years after this. The virus, even though in spots in America is quieting down, we're seeing it pop up in hotspots in different parts of the world. It's growing in a wave, but then it's also growing in ways that we never expected. So it's a very varied virus, and the way that it's affecting countries is also varied. So so that in of itself is not something we expected and is a growing challenge. We do know that we had to take urgent action, and Catherine's going to talk about some of that work even before we started seeing the virus take hold here and other parts of the world. Just in case you were curious, the total number of cases has surpassed 9 million. There's more than 100,000 cases reported each day. Some in some of the regions of the world are growing faster than others. And unfortunately, 472,000 people have died with that number growing. We are first and foremost focused on children. And so the implications that we're seeing for children are far reaching. This is not just a health crisis to them. Yes, it is a concern for their survival and health, but we also know that Education is being disrupted like none other. The safety of children and the protection of children is also a massive concern for us. We're seeing high rates of gender-based violence. We're seeing that many children are going to be facing early marriage because of this, child labor, and trafficking. So our programs on a global scale in different sectors is also something that is adapting and changing. We're going to explore some of those issues in other webinar sessions, so we'll make sure that you receive those webinar session links after this as well, in case you haven't signed up for those, so know that it's coming. Over the years, funders and partners have been an incredible source of strength through this time. They're also seeing their businesses affected, and how they can partner with us has been changing as well. So that's been an amazing thing to be a part of, and also to see how others are really rising up to this challenge. We foresaw and now are confronting grave threats to child survival and health through this pandemic. And like I said before, some other ways are around, women are affected. We're looking at pregnancy complications when women can't access obstetric care. We're seeing more hunger and malnutrition with schools closing and children not being able to access school meals. That's happening in the US. That's something that we are addressing as well. It's also an economic crisis. So it's a health crisis for many, but first and foremost, it's an economic crisis with livelihoods being completely disrupted. Some of the things that Catherine might be talking about is also what's happening to people in their health when they can't access care. So she might be talking about measles and other concerns around polio and preventable diseases. That's been a huge focus of ours. What happens when vaccinations disappear? That is a huge concern of ours as well. These are some of the questions that you might have, rightly so. Sometimes the media is not covering these things, and so we wanted to have this conversation so we could address it. Okay, so now to introduce the speakers. You've heard enough from me. Catherine Bowles, who I mentioned before, she is very humble and fantastic to work with, and probably wouldn't give herself the introduction that I would give her. So let me just say, she's the head of Save the Children's Global Health and Nutrition Initiative. She is also a leader of our global COVID-19 program task force. And if that's not enough, she is one of the architects of our global health strategy to preventing and mitigating the effects of COVID-19, or RACE as we call it. It's rapid action to combat COVID-19 effects. So welcome, Catherine. Thank you so much for taking the time to talk to all of us. Okay, and equally fantastic is our second speaker, Valerie Dordogne. She is a leader in emergency response. So Valerie is based in Bogota, Colombia, because she is Save the Children's emergency response lead for the Venezuela crisis in Colombia. And now I think we could also say she is the leader of the emergency response for the COVID crisis on top of that. So she's wearing many hats and having to consider some serious consequences of what folks are facing on top of the crisis that they're already in. She has a very long history of working with refugees. It's been a focus of her life. She has led over 18 emergency responses, and that's included development programs as well in 7 different countries. There's a lot more to Valerie. I can't keep going on about it. I recommend you watching her TEDx talk. Unfortunately, it's only in Spanish, but if you understand Spanish, I think you should check it out. All right, so into the conversation, Catherine. I hope you don't mind if you start this conversation first, because what I really wanted to do is just take us back in time just a little bit. I think everyone is well aware of what COVID-19 is. We don't need to go into that, but I wanted you to give a little bit of an explanation of how Save the Children was looking at this, this virus, even before it started showing up in the US and other places of the world, and how we're watching it and preparing it. Because I don't think many people know our work or expertise around pandemics, which has greatly informed our strategy. So I think that just gives us a nice linkage into why we're doing what we're doing around health. So Catherine, welcome to the conversation, and thanks so much.
Thank you. I could talk about this forever, so I'm going to try to give some opening thoughts and really look forward to our having a discussion and some questions, because we're still learning, just like everyone else, and this is evolving, and keeping track of this literally every day can sometimes have far-reaching impacts on the life and health of children and families around the world. And so, to Amanda's comment, I have a bit of a background in pandemic preparedness and response. I've been at Save the Children for over 20 years. And back in 2006, there was an initiative that Save the Children, some of us in Save the Children led on behalf of all of the NGOs with some UN agencies like World Food Program, WHO, the Red Cross, Red Crescent societies, in order to work with governments to prepare for a potential pandemic should one occur, a severe pandemic like 1918. And so in 2006, 2007, I and some others from Save the Children deeply dove into what a pandemic looks like. We studied 1918 a lot. We looked at different viruses in circulation at the time. We worked with governments. I traveled all over the world and sat down at the table with governments and talked about how are we going to prepare? What are going to be the indicators that we see happening at a local level, and how do we respond when those things happen? And that's the key to what we're seeing happen now. I'm going to talk about this a lot, is the community level response, because one size clearly doesn't fit all with pandemic response. And so I'll tell you, that really helped us be, as a large organization, known and credible and trusted. And we do actually have a pandemicist on staff. It is not me, but I will tell you that he has been around at Save the Children for longer than 20 years and has never called me at home until mid-February, called me at home and said, Catherine, this is happening. This is what I'm seeing happening. And he is in contact with all of the other pandemicists that you see and hear about now, including Tony Fauci, sort of tracking this virus and knowing what was coming. And so we were able to really get out the door early. We were the first organization to distribute masks and gloves and other protective equipment in Asia. We responded immediately in our Asian countries, in China and elsewhere. Through that, we learned a ton about supply and quality and what was happening with this virus in the moment in the countries in which we were working before it came to the United States in the way that it did, for example. And that really placed us in a good spot to work with lots of others, because I think Save the Children alone, I think, this is probably clear to everyone on this call, but we can't do this alone. Response has to be in coordination with governments and all other organizations, humanitarian and other, working together with the same messages and clear, consistent information. So you may have also heard about the London School, Imperial College, a lot of these academic expert teams that are doing analyses of what's happening today and what they think might happen. We're right at the table with them. We're talking about, what do we see now? What does it mean in our countries? What does it mean for children? What can we do together? And that's been super important. What Amanda called race, our strategy for health, is certainly not Save the Children's strategy, but we were at the table with these expert groups when we talked about what are the most impactful and focused things we can do now in every country, and when this virus really hits and there's widespread transmission at local community levels, what can we do for children and families and communities? And so one of this framework that we created really focuses on, first, at the community level, continuing key services that are really life or death, maternal and newborn care, vaccinations, and with community health workers or local people who can mobilize. And you see this happening in the United States as well. Next is looking at the impact of COVID-19 and how to prevent and treat COVID-19. And we're doing a lot of work, I'll tell you about in a minute, with that as well. And I think what Amanda also mentioned in terms of what we would look at as the secondary impacts of this that we see in the UK, that we see in our developed countries in the US, and what we're already starting to see in really devastating numbers are those illnesses that were already in a country, let's say, exacerbated by COVID-19 because health services aren't available anymore. Continuation of preventive services like vaccinations aren't available or are severely disrupted. Supply chains are out. Local food markets and other markets are out of stock. Lockdowns are preventing people, communities, and families from accessing these things. They can't leave their homes, or they go to a place and it's closed. And so in the UK, for example, in the last 3 months, 47,000 people died of COVID-19. 68,000 people have died not of COVID-19, but because of it, because services weren't available, and that's in the UK. And so when we think about countries like Pakistan and Congo and Yemen and Venezuela and countries that are already really struggling, and we're just starting to see the indicators of this. And so that's what our health strategy will do. That's what RACE will do. I want to tell you a little bit about what we're doing so far, and then tell you what I think the greatest needs are for us right now from my perspective. One of the ways in which we're working with governments and with some of these expert groups that I mentioned, like Imperial College, World Health Organization, is looking at how we can protect the most vulnerable in our communities. And that's different in every country. That's different sometimes in every community. But communities working together, making decisions together, empowered to define an approach to protect their most vulnerable is what really will save lives. And that means not massive lockdown of everyone, let's say, but one vulnerable grandmother in a household. She doesn't leave the house. She's protected by her family and the community, or a pregnant woman, or a child, and how families can sustain life and essential care while protecting those most at risk of COVID-19. And we're doing that in Pakistan now. We talked with the Ministry of Health, and Save the Children led an effort to identify with communities who are our most vulnerable and how can we protect them together, and what are the clear communications that we can give out to communities and families so that they know how to do that, and they have the right information, they have the right masks and gloves and equipment that's available for them. So we're doing that now in Pakistan. In Congo, when we're looking at treatment of COVID-19, we've shifted our Ebola treatment centers to COVID-19 treatment centers, the Save the Children supported centers. And because we're trusted, people are coming. And that's an incredible success in an area that is so highly insecure. And there's a lot of mistrust and a lot of rumors about what COVID-19 is. We are mass training community health workers in countries all over the world. In Somalia, which is another very difficult country to work in, we've trained 25,000 health workers so far. And these are people on the front line in their communities to know and recognize signs of COVID-19, to combat stigma and rumor, and to continue those essential services, like a measles vaccination, for example, for children. I can tell a lot more stories, Amanda, but I think I'll stop there and just say.
Yeah, no, it's great.
No, I have to identify what we need the most right now. The very number one, we got to continue supporting, training community health workers. And that's not always going to be an existing health worker. It could be a teacher. It could be a local leader, a trusted person who can become trained safely and quickly to support their community. That's essential. And the second most important thing is this maintaining of essential services, the supplies for things like measles. I mean, we can't see another polio resurge in the world. And that is what we're talking about. That is the threat we're talking about. If we don't maintain those essential services, and we're already seeing massive disruptions, and Save the Children can do a lot to support that. That's, to me, those are the top two challenges in almost every country. And then the third one, of course, is personal protective equipment, masks and gloves, and the right supply for the right people when they need it. And I'll stop there.
Yeah, I mean, I think that brings up a really good point, is that, I mean, one thing that I have experienced in my own time working with Save the Children is that my safety and the organization's concern around all of our safety has been first and foremost. And so as I speak to country directors and others, you know, that's where their thoughts are as well. It's not just about, you know, the people who we work for, but it's also our staff, and they're putting their lives on the line as they go out every day to, you know, whether it's in a health program or if it's in, you know, a program where they're looking after children who are really at risk, or, you know, visiting homes because they have a disabled child and making sure that they have what they need. And so that's one thing that I've been so impressed upon, is just the stories of, you know, people still doing their job every day and continuing those services.
Oh gosh, and I when I talk to some of the physicians that are treating patients in different countries, and I will sometimes ask them, are you sleeping? Like, how are you taking care of yourself? And one of them told me, one of the clinicians that was, you know, clinicians that we have who is treating COVID patients and working on all the other things I just talked about, training community health workers and helping countries make decisions and plan. And she said, you know, I talk about this with my colleagues a lot, and we're not going to stop till this is over, and then we'll rest. And I just thought, I mean, there are so many heroes in this whole, obviously, this whole story.
Yeah. And then, I mean, I should also call out that while that's admirable and that is, I mean, above and beyond, Save the Children does provide mental health support for our staff. And so, you know, we've talked about this on other calls, and that, you know, with COVID-19 and the concerns that there are for burnout and for other issues that our staff are dealing with, there is immediate access for support for everyone. So just wanted to call that out. Yeah, we're really concerned about everyone's health. Another concern that I've been thinking about a lot, I think, you know, I've seen it in the news and it's coming up a lot, are the growing cases in Yemen. You know, and just very quickly to give folks a snapshot of, you know, the state of Yemen right now. They're looking at their sixth year of war and conflict. There's persistent disruption of aid to Yemen, and that is truly disastrous when you're looking at 80% of the population relying on that aid just for survival. That's 80%. That's massive. We also know, same number, same statistic, 80% of the health system is destroyed. And so we're hearing, you know, I've heard in calls that the country has been hosting, is that they're finding it challenging to find medical staff. Many medical staff are afraid. You know, there's been bombings of hospitals in the past, so their lives, you know, are on the line, not just because of COVID and other diseases, but just due to the conflict. This has got to be one of the most challenging places to work in, if not the most challenging, because it's active conflict. You know, Catherine, can you just give us a sense of what we're thinking around Yemen, and how do you approach that? Because it's almost, you know, unfathomable.
So Yemen is, if I had to say the country I was most concerned about right now, it's Yemen. And I spoke to the team in Yemen late last week. I have been to Yemen a few times myself, and we are the largest health provider in Yemen. And so when there is service disruption, we feel it deeply, and we feel a massive accountability to continue no matter what. serving children and families in Yemen. The team is incredible. And it's the country director for us called their situation the perfect storm. Everything you just described, Amanda, all of it converging. And in fact, we were on a call with other UN agencies and Yemen colleagues, local organizations, talking about this concept of protecting the most vulnerable. I learned that in local languages, there is a specific term for the most vulnerable and the impetus to protect already. And so there's a plan in place now that Save the Children is just now beginning to what we call shield the most vulnerable in this. So that I think is going to be a huge positive step toward protecting cases. We're obviously already seeing cases in Yemen. The London School of Hygiene and Tropical Medicine recently has highlighted Yemen as potentially the country that will be devastated the most in the world. And their predictions say within the next 12 months, 11 million cases of COVID, 85,000 deaths, and that's just COVID-19 deaths. They made a point of saying this is not the number of people who will die from this, what we call indirect, right? From all of the other diseases, from the service disruption. Now in Yemen, there is 100% service disruption of these essential services. So that means pregnant women are not getting prenatal care, newborns are not getting support, vaccinations are not happening. And so we are mobilizing, we are maintaining all of our health clinics functioning, we're mobilizing community health workers, and we just infused, we've not, we don't have the resources, no one does, that we thought we would have, but we've given everything that we have to Yemen right now, which is around 1.4 million that we have raised so far in health. We decided right now we can make the most impact if we invest in this frontline health worker in Yemen and continue these services. And so I think you're quite right, Amanda, this is something that we need to be watching and supporting, but I feel like we are in a very good place to Save the Children at the community level and the national level to make a difference. I'll stop there.
Thanks, Catherine. Yeah, tragic. I'm sorry for the fast pivot, but I want to shift to a different part of the world as we're seeing number of cases grow. I mean, frankly, there's now some of the largest and fastest growing hotspots in the world in South America. So just, this is where we'll bring Valerie, your voice in, if you don't mind. If you could just give us a quick background, maybe just, why you're there, what has brought you there, the kind of the crisis that's been building in Colombia, and then how that, is really a concern for the folks, the Venezuelans and some Colombians as well, within this crisis, within a crisis.
Thanks, Amanda. Yeah, just maybe a little bit of background. Colombia have been suffering from an internal conflict for 53 years now. So even if many knows about the peace process, it's still a process, and this process is not over. And there is a lot of issues around conflict and around the guerrilla is still active. The one who have not signed the peace process, and the one who have signed the peace process, we still have dissidents. And most of them are at the border. Colombia is 2.5 times France. So I know for the US it's very small, but I'm European, and for me it's big. And we share a border with Panama, with Venezuela, which it's over 4,000 kilometers, with Brazil, with Peru and Ecuador. So it's also a little bit of a perfect storm. On top of trying to get out of the conflict, certainly there is this massive migration from Venezuela, from a country who have come to a point where people could not continue living there because there is no more health services, there is no more income generation possibilities, there is no food, right now there is no more gas for cars, and you can see the cars are coming through, and they are, piece and pieces the way that they're still running. So certainly getting out of this conflict. We have all this crisis, and we have now more than 1.8 million Venezuelans in Colombia who have come through the border. We have 4 departments of Colombia, these 4,000 kilometers of border, who have that border with Colombia. But in reality, there is 5 official crossing points, but non-official, they're more than 1,000 or 1,500. Where people cross, and they used to cross, children used to cross the river in Arauca to go to school. They continue to do it, but now they do it with their parents, and they stay in Arauca, and that has been a burden for a country who had never had such a huge migration. The COVID is adding to that, that 1.8 million of Venezuelans who are here, and like a lot of Colombian, because 60% of the economy in Colombia is informal, so people are living from a paycheck to paycheck every day. 90% of the Venezuelans were in the same position. So with the COVID coming in, and now we have been in quarantine and staying at home for the last 3 months, and it looks like we're going to go for another month and a half. It looks like the peak in Colombia is going to be at the middle of August, and even if it's so, people still say we can die of COVID, or we can die of looking for food for our children, our families. So it's kind of a catch-22 there, where people are saying we need to go out. So what's happening is people are more and more going out, saying that they have to work. So even if we have been confined for the last 3 months, it's not going down. The numbers are going up. We're now more than 2,000 dead, and over 70,000 confirmed cases. We have not enough testing done in the country, and not enough testing coming. Ventilators are very slow coming, and one of the reasons that the government gives is that other countries had the capacity to die them before, so we are waiting for more. So the capacity right now, for example, in the capital town, Bogota, which is 10 million inhabitants, is over 60% of the system is overloaded. And the mayor has been very clear that if we get to 75%, she's shutting down again the whole country, the Bogota, the capital, and the country. And the issue is that at the border, in the small town, at the border with Ecuador, at the border with Venezuela, we're seeing more and more cases, and a health system is very weak, and have been weak before the COVID, and now is weaker. So add to that the Venezuelans are starting to walk back, because they used to walk down to Ecuador, to Peru. Now they're walking back. They're getting out of Ecuador, out of Peru, trying to cross again to Venezuela, because they can't find a way of working, of earning money. So they're saying they should, they're better going back home. But it's a long walk. It's 5, 7, 10 days walk, and coming from countries who have a very strong COVID now numbers and death toll. So we have about 0.05% of people are walking back. But then we continue to see that because they can't find anything to eat in Venezuela, they're coming back and forth. So the crossing and all the epidemic have come through Venezuela since years in Colombia. So we have many issues, and now we're seeing a picture of our health clinic. Our health clinic is a sexual and reproductive health clinic where we're supporting pregnant women during their pregnancy. We have women who used to come walking from it's at the border with Venezuela, and they used to come walk 2 or 3 hours to come to see our OBs and our nurses. And even Colombians now want to come to our clinic because it's seen as the best care. And today we have this clinic at the border. We also have other clinics who are working. General clinic were closed. We're the only one open. We are the only one responding right now, continuing to have those women coming and being the only one responding to the COVID. And we have also given support to the local hospital. And we have to say also that 30% of the women are coming to the clinic are underage. So for us and for the staff, it was extremely important to continue to be open, to continue to support the local hospital, to continue to be there for the beneficiaries. But it's the case with everything we do. None of our programs have closed. None of our protection programs, none of our education program have closed. Our WASH and the clinic who have been supported by LDS, and for us, they've been a great donors and a great support because of them, this clinic is open, and because of them, we had the capacity to have community health committees in the settlement, and also WASH committees in the settlement. We have been able to start latrines that we didn't have in any of the settlements because of the support we had from CVS, from LDS, and from the different donors that you have contacted us with. So that has been a great help. And we are also supporting with all the COVID, between the health and WASH, we have come up with a COVID kits that we're distributing to our beneficiaries, and further than that. In La Guajira, which is an indigenous part of Colombia and is the border with Venezuela, 95% of the population have no access to running water. So being able to respond with our WASH program is extremely important for us to be able to continue with that.
I'd have to attest to how fantastic those health clinics are. I was in Colombia, and Valerie, you were a fantastic host and brought me to the border. At that point, you know, it was crazy busy, so many people. So I can't imagine what it's like now, with lots more people trying to get back into Venezuela and coming out of Venezuela, and just kind of the fear that those people may be experiencing now. And it you know, there were so many young women, and I got to meet some of these young women in the clinic, and I mean, they are so young, and their stories were so heartbreaking, you know, pregnant, traveling on the back of motorcycles over bumpy forest roads, to have, you know, a prenatal appointment. And they were so committed every single day, you know, to do that, not every single day to do that journey, but every appointment they had. And, you know, reflecting on my own journey as a mother and what I had to do. I mean, it was heartbreaking. But the health clinics could honestly be a health clinic here in the United States. It's something that, you know, working for Save the Children, I was so proud and so honored to see. So thank you again, Valerie, for that. One of the things that you and I talked about the last time I was in Colombia was hoping to grow that community health worker program to get into those informal settlements. And those informal settlements, you know, I don't know the number, but, you know, easily looking at them, you could see hundreds, if not thousands of these shacks, right? So built with sticks and trash, and that people are building for themselves. You know, where is that program? How is it today? You know, is that something you were able to grow? You know, because, you know, with reflecting on Catherine's point of how instrumental that frontline community health worker programs are, where is that for you in Colombia?
Well, we have now 2 mobile clinics, so we're going towards the population, and we want to make sure that we have community health committees, so that we bring the knowledge of the COVID and the knowledge of health into those communities. Settlements, you know, irregular settlements or informal settlements, some of them in Colombia, because of the displacement, because of the conflict, have been up since 25 years. So now people have built houses, but it's still an informal settlement. We've never have been recognized. So that is a bit of our worry. And we know that we have to bring the knowledge in the settlements. Most of the people at Guajira and the one you have seen are people who are Venezuelan and Colombia. They're indigenous population, and for them there is not a border. The problem is that they can't find any food in Venezuela right now. Their houses have been taken. There's nowhere they're going to get jobs. So they're coming to Colombia trying to find that. But there are people who are coming and going. The other thing is we're working also with CVS to see if the model of the clinic that we have, because the clinic is sexual and reproductive health. So we're helping women who are pregnant until the end of the pregnancy. Now we're going further with nutrition. We want also those women to know about nutrition, and we want to, you know, to have a safe place to say breastfeeding, you can do breastfeeding. And we're working also with the hospital to get them in their mind that breastfeeding until 6 months, you know, exclusive breastfeeding until 6 months, and until 2 years, continued breastfeeding is very important. But what we want is to continue with the model. Our model is also to do GBV. We work a lot on gender-based violence. A lot of those women, and I remember these girls of 14 who have been raped in Venezuela. The whole family decided to come to Colombia. She had been coming to the clinic not only because of her pregnancy, but she'd been talking with a psychologist of the clinic about what happened to her and how to accept what happened to her and what to do with this baby.
Yeah.
The only thing she wants to do right now is to go back to school. You know, each time I see her, she's telling me about, you know, she's training, she's doing the teacher for a younger brother and sister, and we're now working with our education program to make sure that we can get her back to school because the family is supporting that. So what we do is really integrated. So it's not only, you know, you're going to have a baby, but what happened with that and what you want to do with your future and how we can help you with your future. And for us, it's very important. And what I want to do is to take that model and bring it to the Ministry of Health, and we are under the clinic, the public clinic in Guajira, and have this model replicated in other places in how to better support women who are pregnant, young women who are pregnant, avoid to have young pregnancy, but also having this care around the mother and the infant.
Yeah, it's that continuum of care that has to happen. You know, it doesn't stop after they have a baby, especially when you're 14. That's just, it's not a life. One question we did have for you, Valerie, is can you just name some of the other non-governmental organizations that you're working with in Colombia? I know there's a few. And a follow-up to that is just, what's the update on travel restrictions in and out of the country?
So one thing which is we are starting to work on, so most of the response we have been doing until now in Colombia have been a direct response from Save the Children. So we have over 230 people working in this emergency today. The local NGO have been more looking at the conflict and the post peace process, and we're trying to bring them now into this refugee and more, it's a migrant crisis. But we're working with few Venezuelan NGOs, LGTBE NGOs here in Bogota, because we also have a program in Bogota, and others who are working with migrants who are coming to Colombia. We are also working with the schools. So most of the work we're doing is usually with the local authorities. So the Secretariat of Education, the health, as I said, we work with the Ministry of Health and the clinic. We are considered under the clinic of Maicao. We are working with the welfare system also, because we're doing case management. We are the only one doing case management right now in this crisis. So our work is much more with the government, and the response of the government have been really, really good for the migrant crisis.
Yeah. We've got a, oh, sorry, did you want to finish that thought?
Your second question, I remember the first one.
Oh, just the travel restrictions in and out of the country. You mentioned some of the travel restrictions and the lockdowns in country, but do you happen to know if there's in and out of the country right now?
So the border are closed, but as I said, we have more than 4,000 kilometers with Venezuela. With Ecuador is about 1,000 something, and then in Ecuador we have a program for the conflict response, and people are coming through boats, and that's why that part also the country is now very high in cases, because the cases started in Ecuador, in Guayaquil, which is a coastal a second town of the country, and people are coming by boat. So it's very porous. It's like people are coming and going like they've been doing for ages. So if you look at the formal borders, they're closed, but people are coming through different places, and it's very difficult to control, because it's also the places in every conflict. Borders are where, you know, the conflict is, and where the guerrilla is right now. So it's very difficult to control, and there've been altercation between the militaries and the guerrilla at the border with Venezuela and with Ecuador. So it's a bit difficult.
Yeah, it must be a very challenging issue to navigate. And, you know, we are at that border, and that's something that our staff and you know, your team is facing and navigating. So it's hard work. We've got another question, and I think both could offer some thoughts around this. I'll let Catherine, maybe you could speak to a certain part of the world. You know, The Rohingya crisis comes to mind as one of the places where social distancing is just not possible. There's other places, India, Egypt, there are massive challenges in terms of social distancing and access to basic services in those areas. The question is, you know, those tend to be crowded and with limited resources like slums and refugee camps. How are we supporting those areas when social distancing is just not an option?
It's just not possible. I think the example you give of the Rohingya refugees in Bangladesh is one of the most densely, if not the most densely populated places in the world. And yeah, it's just not possible. So they're also a massive health provider, but also protection and education. We're doing a lot of work in that setting. And I mentioned this earlier, but communications, clear communications, what we call risk communications, is absolutely vital, especially in a place where you cannot physically distance. And in the Rohingya, for example, a couple months ago, in the population, they had heard about, you know, that we've done a lot of had a lot of conversations with the population there. They had heard about this disease, and they felt that it was preventable if you saw you wouldn't get it if you saw a certain image in a cloud formation. And that was the only way you could protect yourself. And if you saw it, you were good. And if you didn't, you were going to die. And so we've done a lot of work working with that community around risk communications. And we are also working in an isolation and treatment center where we are setting up right now people that there is transmission already there, but where people that are infected can go. That's one comment. And I think messaging, though, in general, and maybe Valerie can tell us about Colombia, but finding those messages that are clear, simple, well understood, and contextually significant, that is the most important thing that we can do. So Valerie, I don't know if you want to talk about that too.
Yeah, we have different reactions. For example, the indigenous population on the border with Ecuador, seeing that foreigners, not only us, foreigners from other countries, but people who are not from their community are the ones bringing the COVID. And in a way, it's true. The COVID in Colombia started with people who have more money, with people who have been able to travel, had the capacity to travel, and brought the COVID in. It didn't get to those communities because it started in those communities, and now is going down to the most vulnerable communities. So some of the indigenous are closing down and saying, we don't want you guys, we don't want anybody who's not from the community here. And some of them are starting to go back into their ancestral part. And thank God we have staff who are part of the community. So we have hired staff in those communities because it's very difficult to, even without the COVID, to be a foreigner from the community and come in and say, we're going to do education and protection with people that you don't know. So that has been very helpful. We have been able to get to the community, leave our COVID kits and everything we're distributing, and they're doing the job inside the communities. But as you say, we have staff going to see them, distributing the COVID, giving the messages. We have a person who is specialized in giving messages in radios, and she's making messages that we're going with a car around and we're giving those messages, but we're also talking at 2 meters distance, 6 feet distance with the community. And because we had, with the work we have done with the clinic and with WASH, with the support of LDS and you guys, we had the community WASH committees, which is done by people in the communities. Mm-hmm. Now what we need to do is to continue with, as Catherine was talking about, is to train them into the health part. So that is but we're messaging all the time, every day. Also in the material that we're giving to the children, we talk also about the COVID, and Save the Children around the world have come up with simple messages, very good materials that we're just reusing and translating and reusing.
Yeah, I think what's been striking is, as I hear how different countries are doing those information campaigns, is the difference in how they're contextualizing to the people who are there, the cultures, the languages, and it's just been astounding. to see how many countries we work in, and then where it's been a success, and learning from those successes. And it's also, you know, I've been struck on how low tech, right? We often talk about how important it is to you know, use technology and get the most we can from it. But some of the most successful programs have been so low tech. I mean, so Valerie, you talked about someone driving around with a car and a bullhorn, right? That is how you're going to reach thousands of people very quickly who don't have access to internet, who might not have access to radio. So, you know, and then in other communities where the radio has been used not only to, you know, provide information around how to wash your hands and dispelling rumors. I think, Catherine, you talked about some of those rumors. I've heard rumors are a huge challenge in certain communities around, you know, what this disease will do to you, or what, you know, foreigners will do to you if you have the disease. And so that it's just interesting to see and hear how we're learning. Different, you know, countries are learning from each other on how to do those campaigns. Yeah, that's great. So I want to be aware of time. We have 10 minutes left. We've tried to get through a lot of the questions, and I think it's great to make sure we've got everyone's thoughts in there. You know, but kind of wrap things up and to give some final comments. Catherine, I hope that's not like a too big of task, and kind of what your final comments have been around this conversation, and kind of where your thoughts are in the future. This is something that's going to keep growing. This is not, you know, the end. We haven't just developed a strategy and then it's now we use that strategy, we move forward, because from what I've heard, that strategy could change very rapidly as you know, the situation changes in different countries.
Thank you. I think it's easy to feel a little bit of relief, like, okay, we've done that part, we've sort of figured this out, and sometimes I get worried because I hear us talking about, well, we're out of the first wave, and it's as difficult as it is. We have to both put out as Save the Children, and in our own families, we have to put out the fires that are occurring every day, and we also have to be prepared and able to respond for the next 12 to 18 months of this pandemic, keep our finger on the pulse of what's happening, and pivot really quickly. If we see something changing, we need to change with it and respond to that change. And so Save the Children, you said, Amanda, you're so proud to be a part of Save the Children. I mean, I couldn't agree more. I talked about our clinicians and how heroic I feel like, I'm not just our clinicians, the frontline workers across the world that are doing work with children on behalf and for children on behalf of Save the Children is amazing. And we got to stay in it, and we're going to stay in it. And I think Amanda, you may have mentioned this as well, but the next 12 to 18 months of this pandemic, and then mitigating the impact on children and their lives because of the pandemic, and staying in it and tracking what are the needs most affecting children, who are those children, and how can we be there for them. This has changed our lives. This has changed our whole organization in ways that I think are the right ones. And I certainly am personally very committed to being a part of Save the Children as we go through this, and really, really appreciate all of you who have joined this call to hear more about it. We absolutely could not do this without the contributions that have come in and the support that we've received from really all over the world. It's been amazing.
Thanks. Valerie, would love to end this conversation with a thought for you, and I hope you don't mind, you know, bringing some of the words and thoughts of people who, you know, you see on a daily basis, and the people that we all work for. When I was in Colombia, you know, I'm thinking about my time then and our work when we talk about the front line. I wanted to bring some color to that, right? So it's not only the people who are taking care of the sick, but it's the education staff that gives hugs, right? It's the protection folks and the folks at the health clinic who hold hands. There is so much about our work that is more than just delivering services. We stand with these people, we stand for them, and sometimes it's just sitting in that moment with them experiencing the worst day of their life, or the sickest moment they've experienced, or it can be in the joy that some of these children have, right? In the education programs, singing songs in Spanish, I couldn't do justice to. And you just have, you know, our staff just have an outpouring of love for these kids. You know, how do we do it without being able to hug them and hold them in good and in challenging times? And I just wanted to see if you could bring a story of hope or love that you've heard from a child, and you know, during this time, you know, what is the resiliency that you see in them that I think that we see in so many of the folks we work for?
Yeah, you know, I've been quarantined for 3 months, and you know me, I'm all the time in the field. I go every week. I go to the field and talk with the staff and go to see the children and be inspired. And all the program we write is based on what come back from the field. You know, because we can't hug them, and all the staff have to wear the mask, and they have to have social distancing. Our workplace, which is a great place for people to talk. So we didn't have so much, people were active in Colombia in the workplace, but now they're double active because they're putting all those pictures of those children receiving this backpack with Save the Children, with all the material for them to continue studying and school. And you see all those smiles, and the staff is every day, you know, every night I go through all those workplace pictures and all the activity they're doing, and they're going far away. And sometimes, you know, it's a place that you have to go by boat 6 hours to get to the place. And we are the only one who are being authorized by the mayorship. It's a very small town in the middle of nowhere to get there and to get all the materials. And it's been a blast to look at these pictures every day and to listen to the staff saying, hey, you know, look at this kid, how happy he is, and showing us how they're you know, from a distance they're doing this, the work in the document that we're sending. And now we just had a new music group in Colombia who is one of our sponsors now, Angels. And we have those kids in Guajira, Arauca, and Cali who have come up with songs, and we have proposed to them, hey, can we put those songs into, you know, real good material? Because you have seen some of the song we have. It's not a very good material. It's done on the phone or whatever. But they have said yes. And they've been so excited, and they've been working with those kids in the distance, by phone, by the computer, but whatever we can find to get the lyrics, to work with them, and soon I hope we can share those songs. I think it's 3 of them that they're doing together. So yes, we you know, I have to pay tribute to an amazing group of staff who have never let down those kids, and even with the social distancing, they're going to see them. They go door to door. In a real heat that, you know, how hot is over there, and they continue going, and they continue making sure that on workplace we know of how happy the kids are, and they tell us their stories.
Yeah. Well, thanks. Yeah, the hope and the resilience, I think is massive, not only of the people we work for, but also our staff. So I just wanted to say thank you to both of you, Catherine and Valerie. We couldn't do it without you. We couldn't do it without the amazing supporters who joined us today. I look forward to bringing more folks on from different communities and different countries to talk about our programming. And we hope to see you next time. Thanks so much. Have a great day.
Thank you.